Thank you, and thanks for inviting us today. My name's Donna Smalley and I'm the Physio Lead in the Learning Disability team at Bradford District Care Trust.
My name's Tracey Barningham. I'm a Community Learning Disability Matron and I'm working with Donna in the Health Support team over in Bradford. And today we're going to share with you the Keeping My Chest Healthy project. This was developed by the MDT in Bradford, and we'll take you through how we've developed a system-wide approach to improving respiratory health, the impact that this has had so far, and how it's shaping future care. Next slide, please. So why did we start the Keeping My Chest Healthy project? Well, you're probably all familiar with some of these statistics, but if we take a moment to just focus on the key data that's highlighted here on the slide. First, people with learning disabilities aren't just dying younger. Nearly half, 42%, are dying from causes that could have been prevented. And respiratory disease continues to be one of the leading causes of death, and we see this year on year in the leader data. But what's even more concerning is that if you have a learning disability and you belong to a minority ethnic community, the situation's even worse. And this was made painfully clear really in the NHS Race and Health Observatory report in 2023. When we reviewed our local data in Bradford, we were really shocked with what we found. So for those people who identified as white British, the average age of death was 56. But for somebody from an ethnic minority community, that age was just 26 years old. And again, 70% of these deaths were linked to respiratory disease, so a much higher rate than the national average. And I guess these statistics, that really they're not just numbers, they represent real people, real families and real losses that could have been prevented. And this is really why we started the project, to make a tangible difference and really try and improve the health outcomes and tackle preventable deaths head on. Next slide, please. So our goal was simple, really to shift the focus from reacting when people became unwell to promoting health and preventing respiratory illness. Ultimately, we wanted to reduce chest infections, hospital admissions and avoidable deaths from respiratory disease. So we will look at each of these areas in more detail, but in summary, the Keeping My Chest Healthy project has got 4 main strands to it. The first one was about creating a system-wide way of working through the development of an MDT respiratory pathway. And the second was about creating simple, user-friendly, personalised care plans. We then focused on increasing awareness around respiratory health and the modifiable risk factors through developing a digital hub. And then more recently, we've gone on to develop the clinical professional section on the site, which is where we provide some CPD accredited training modules and access to the pathway and all the clinical tools that have been developed. But I think most importantly, all of this work has been co-produced with our experts by experience, so the people who would actually be using the service and the resources. Next slide, please.
So this is the slide which shows a summary of the key steps of the respiratory pathway, which I'll just briefly run through now. So first, we use our scoring system to identify people who are at risk of respiratory disease. Then we have an MDT discussion to review the scores to explore whether the risks are linked to factors that we can change. If they are, we add the person to the respiratory pathway and identify the key professionals who need to be involved. Once they're on the pathway, we gather at least 6 well baseline readings, and this helps us to understand what well looks like for that person, which also helps us to spot any early signs of deterioration. We also complete an MDT holistic assessment to make sure that any existing health conditions and known risk factors for respiratory diseases are well managed. And then finally, we work closely with the person and the family or carers to create their Keeping My Chest Healthy care plan. And this really just brings together all of the recommendations from the different professions involved, making sure that the person has got the best possible support. Next slide, please. So we know that anyone can experience respiratory illnesses, but for people with learning disabilities, the risk is often higher because they may have a combination of risk factors that make respiratory issues more likely. So if we take a minute to think about what some of those risk factors might be, this slide just shows the broad range of risks that were identified by a group of professionals in a previous session. So it's a collective response from experienced clinicians. But if we consider, what if a newly qualified clinician or somebody new to working in LD or new to community working were to write the list of the things that they were going to consider in terms of respiratory risk, do we think they would remember to consider everything? And that was the challenge we faced. The risks that were identified depended on the clinician's experience, their knowledge, and even factors such as the time they had available. We wanted a system that was simple, consistent and easy to use, ensuring that anyone, regardless of experience, could accurately identify risk. At the same time, we knew our teams just don't have the capacity to complete a full respiratory pathway for everyone referred to our service. And in many cases, that wouldn't be necessary. So we needed a way to prioritise those at the highest risk. And that's how the respiratory scoring tool was created. Next slide, please. So this screenshot, it just shows part of the respiratory scoring tool that's on our website. It was initially developed using our clinical knowledge and experience, but then it's been refined over time using to reflect new evidence and guidance from the British Thoracic Society and the latest NICE recommendations. So this tool provides a structured way to assess respiratory risk factors, and based on the results, the person will either move on to the respiratory pathway for further assessment or receive information and support about the risk factors, how to reduce them and where to get help if their needs change. So we already looked at the really wide range of potential risk factors, and this tool helps us to systematically evaluate each one to produce a final score. The score doesn't just tell us the overall level of risk, it also highlights where the risks are coming from. So, for example, are they mostly related to eating and drinking, or do they stem from movement and function? Because this can help us to identify which professions need to be involved in the assessment and care planning. So if someone scores 5 or higher, this would trigger a detailed discussion in the MDT clinic, which allows us to break down the scoring, pinpoint the risks and decide who from the MDT should be involved. But if the score is 5 or below, but the clinician completing this tool still has some concerns, we don't ignore it. We discuss it as an MDT and explore whether they could still benefit from the respiratory pathway or from being provided with some other advice or information. So this tool's been tested and refined now over the years, making it sensitive enough to identify those at real risk without it being so broad that it captures absolutely everybody. Next slide, please.
So once assessments have been completed, the Keeping My Chest Healthy care plan is created, and this is what you can see on the slide here. This is an accessible document that pulls all the recommendation and advice that's really unique to the person into one place. And then the plan will travel with that person across different care settings and really just make sure that carers who might not know the person well have got all the information and the confidence they need to manage respiratory health. So the plan follows a traffic light system. We've got the green section of the plan, which describes the person when they're well, so how they look, what their voice sounds like, and what their well baseline readings are. And this section also describes what the person needs to do to stay well. So for some of the people we support, they may need lots of interventions such as cough assist, suction, or careful positioning on a daily basis in order to stay well, and in the green. The amber section of the plan, that describes a person when they're becoming unwell and they're at risk of further deterioration. And really it documents what you might notice in their observations, but also what the soft signs of deterioration might look like for them. And these can be really subtle changes that could easily be missed by somebody that doesn't know the person well. The amber section also describes what we need to do to support the person to move them back into the green. So, for example, we may be making more modifications to a person's eating and drinking because when they're unwell, they're at a higher risk of aspirating. And we might be increasing interventions such as chest physio or cough assist. And then finally, the Keeping My Chest Healthy care plan has got a red section, and this is where it details the information and equipment that the person might need to take with them if they required a hospital admission. And once this is in place, it's flagged really in the patient's record, just to make sure that there's continuity of care across both primary and secondary healthcare services. Next slide, please. So while the care plan was designed to be simple and accessible, we really recognised challenges with the paper format. Documents can quickly become outdated with multiple versions in circulation, and carrying an A4 document is just not always practical. And additionally, the English-only format really created barriers for those people whose first language wasn't English. So to address this, we've developed a digital care plan, which is now being piloted within our service. And you can see a small screenshot of this on the slide here. The digital care plan is accessible from any device, so a mobile phone or a laptop, and it's fully translatable, so really trying to address the language barriers. It integrates with our digital hub, so it links directly to the resources and the educational videos that are on there. And the digital care plan really ensures that the latest version of the plan is always in use. For those people who prefer paper, we can still print off a paper care plan where that's needed. I think another benefit really of the digital care plan as well is the ease of completion. The digital format really allows individuals and their support networks to work together on the plan in real time, and it makes sure that the plan's co-produced and evolves with changing needs. And I think finally, in terms of the digital care plan, it really aligns with the NHS's commitment to sustainability. So we're helping to reduce that paper waste and supporting a net zero healthcare system. Next slide, please. You're mute, Donna.
Sorry. So as Tracey was just saying, the care plan and the guidance that goes along with it were developed to be accessible, but they were only available in English and in written format, which isn't always helpful for families or carers who prefer visual or spoken information. We realised that short, focused videos could be more effective for demonstrating techniques and interventions. They serve as reminders for care staff and families, and they're also really useful for new or agency staff. So whilst there are videos on YouTube, the feedback we received was that they were often too long, too clinical, and they didn't represent the people that we support. So families and carers told us what they wanted was bite-sized videos with just the essential information in a clear and easy to understand format that would be available 24 hours a day. So we've now created the digital resource to meet these needs. The site works on all devices and can be accessed using a QR code on paper care plans or using a link in the digital version of the care plan. And all the text on the site is fully translatable into multiple languages. At the end of the session, we'll share a QR code and a link so you can explore the site for yourselves, but I'll just give you a really quick summary here. So you can see on this slide a screenshot of the home screen, and this part of the website is divided into 4 key sections, so those coloured tabs along the bottom. So the first section, the green section, is how can I keep my chest healthy? So a health promotion section, including information about how to stay well. We use easy on the eye images throughout the site because they're familiar to our service users, and we also include links to trusted resources throughout the site as well. So the next section, the purple section, things that affect my chest health. This covers risk factors for respiratory health, and it includes information about things like oral hygiene, dysphagia, the importance of positioning when eating and drinking. And again, we use images and animations to make the information more clear. The blue section, the care plan resources and guidance section, contains the videos and guidance around what a person needs to do to stay well. So the videos are currently available in English and in Urdu, not just with subtitles, but in fully translated narration, because we really wanted this resource to be accessible to everyone, regardless of literacy or language. And we used AI avatars to make this possible. So the avatar we used was chosen by our focus group. They felt she was relatable and trustworthy, and they named her Zara. She's the narrator for all of our videos. And this was a real game changer because it meant we only had to film once. Zara's voice can be updated in any language without us having to complete further filming. To keep the videos short, and each video is around 3 minutes or less, we also included extra information below each video in text form. And that means families can read the full script if needed, but also that all text is fully translatable. And it's also useful for carers when updating support plans. And the last section on the screen that you can see here, the red section is how to know when I'm unwell, and this area includes information on recognising signs of illness and includes guidance on spotting sepsis early. So those are the resources that were designed for people with a learning disability, their families and carers, although we have found that students and professionals also find these resources useful as well. These resources are freely accessible, so you can have a look through them in your own time later, as I said. But the most recent development on the website is a dedicated area for clinical professionals. So this area is accessed via a password, and it contains all of the clinical tools such as the scoring tool, the holistic assessment, etc. And it also holds the full programme of CPD accredited training modules to support professionals to use the pathway in their areas. Next slide, please. So we developed the training modules as we needed a sustainable way to share the respiratory pathway, and with growing interest from other NHS trusts, we knew this just couldn't be reliant on in-person training. So in order to achieve this, we've developed this CPD accredited course. The modules have been designed to be short interactive learning sessions using videos, case studies and activities to enhance learning, which can be completed in one go or in bite-sized chunks and then revisited again later if required. The initial feedback on the training has been really positive, and you can see some of the feedback on the slide here. People have found that the case studies and the interactive elements of the training have really brought the learning to life, and it's felt that it's been beneficial for all healthcare professionals, regardless of the role or experience. So the clinical professional section of the site also includes access to the respiratory pathway itself and all of the clinical tools that have been developed, as I said. By making these resources more widely available, we hope that it will enable other NHS trusts to benefit from the investment of time and resources that we've already devoted to this project without them having to start from scratch. Next slide, please. So as I mentioned previously, there has been a real thirst to find out more about the project, and we were approached by a number of different trusts who were keen to find out how they could integrate the pathway into their own services. So to make sure the pathway is as effective and adaptable as possible, we invited a small number of trusts to pilot both the training and the pathway resources first, just to allow us to really fine-tune and refine the approach before rolling it out on a larger scale. So the response was really overwhelming. We had teams and individuals from across the country expressing an interest in becoming early adopters, but we shortlisted 4 teams to work with in Kirklees, Wakefield, Bolton and Lancashire and South Cumbria. And those teams are now well underway with the training modules, and they're starting to apply the pathway in practice. But the feedback has been really valuable, helping us to make some final refinements and ensure this can be successfully implemented more widely. And we're also receiving some really great feedback on the scoring tool as well. Professionals are saying that it's easy to use, it's helped them to identify when onward referrals are needed, it's supported them to plan their work and prioritise their interventions, but they've also said they revealed health concerns that they weren't already aware of or addressing. So this is really encouraging for us, and it highlights the impact that the tool could have if it was used more widely, I think. Next slide, please.
Now, I guess we're at a point now, really, where we can start to examine the data from the pathway and the outcomes from the project. And I think by focusing on prevention and early detection, we've really seen a significant reduction in chest infections and hospital admissions. So when comparing 12 months before and after implementing the pathway, you can see here on the slide, we've seen a 54% reduction in chest infections treated with antibiotics and a 70% reduction in hospital admissions for respiratory conditions, which is really encouraging. So the project is not only really improving health and quality of life, but it's also delivering real cost savings for the NHS. The project has been nationally recognised. We were really pleased to win the HSJ Learning Disability Initiative of the Year in 2024, with the judges commenting on the simplicity and impact of the initiative, as well as the scalability and the potential for greater impact. Next slide, please. So do take a look at the site. If you follow this QR link here, this QR code, it will take you to a form that you can complete if you'd like to find out more about using the pathway and the resources in your own area. Next slide, please. And here is the QR code to the site. So please, have a good look through, and feel free to share and circulate the resources. Thank you. And I'll hand you over to, I think, Heidi and Sarah.
Thanks, Tracey. In fact, before we hand over, you finished 5 minutes early, which
Very
is
good.
amazing. So I've decided to step in very briefly and just say, are there any questions in this 5 minutes before we hand over to Heidi? Because I think the work that you've shared is excellent. I've started to look at the risk assessment and the online tools, and they're really useful. But has anybody got any questions? Would you like to ask Tracey and Donna a bit about how you can access it, perhaps how it could be used in annual health checks? I've got some question from Nicola Turner asking which parts of the care plan are the learning disability teams responsible for and which come from other services. Nicola from Dorset, do you want to take that opportunity to ask Donna and Tracey about that?
Yeah, thank you. The project sounds amazing. It was just so sort of locally we are struggling maybe to link in with sort of mainstream and other respiratory services. So I just was in terms of community provision and how that works. So I was just interested to know kind of which parts come from the LD team itself, which parts come from, does the GP take responsibility for, which parts do you link in with other respiratory services, and how that works in your area, if you're happy to share.
Do you want me to go, Donna? Yeah. I think it's really a collaboration really across primary and secondary care. So we've got excellent links in Bradford with our sleep team in Leeds. So we work jointly with them in terms of supporting people with NIV or CPAP or cough assist machine. So it's about sort of working together really. Obviously they're responsible for the prescriptions and sort of issuing the equipment, and they were involved in creating the resources that we've used and developed on the site. And again, we link really closely with the respiratory teams in the acute trust. So we have a bi-monthly meeting with our acute hospital where we can sort of discuss people who have had a recent hospital admission and really share sort of best practice and make sure that there's a joined up plan, some continuity of care for people who've been in.
Thanks very much, Tracey. Oh, Donna.
I was just going to say, the LD team, we kind of take a lead in coordinating all of that advice, but we're really just, it's a summary document of all of the different pieces of advice that are coming from different areas. So if somebody's accessing, different services, we've got people that are accessing, various different services in the hospice. We pull together their guidelines and recommendations and pop them into the care plan as well. So different clinicians populate different areas.
No, that's brilliant. Thank you. That's really helpful. Thank you.
Thank you. And then if I have just one question from Susan Bates, and then we'll hand over to the next speaker. Thanks, Susan.
Hi, my name's Sue. Just on the back of all the leader information and the figures and what have you that we've got, certainly within our area, we're looking to work with our local area contract for leader on a bit of a project around I want to say preventing aspiration pneumonia, but I know that preventing is not necessarily the right word. I'm trying to reduce the risk, and I'm just wondering whether I think it would be great to share this with Anne and see how we could kind of pull something together, certainly in our area across Cambridgeshire and Peterborough. It looks absolutely bloody fantastic, to be honest, for want of a better way of putting it.
Thanks, Sue. And I wonder actually, Tracey and Donna, whether we could collate, if anybody else is interested in finding out more, if you could put it in the chat, what something that Susie and I could do with Teresa is we could make an introduction, perhaps, and work out how to take this forward, because somebody's also asked about registering. So if you've got any further questions, let us know. Sorry, Donna.
I was just going to say the QR code on the previous slide takes you directly to a form on the website, which you can complete to get in touch with us, and that will kind of register your interest, and then we'll have your email address and we can get back to you from there.
I'll put that into the chat. Thanks very much, Donna.
Brilliant.